Mother's Day is almost here, and we are with Dr. Angela DeRosa this morning talking about women's health and the importance of knowing the history of our mothers.
Moms are very important in our lives in many, many levels, but their history is also important from a medical standpoint because things do pass through families, and what your mother may have experienced, you certainly may be in for. So for instance, if you have a family history of thyroid disease, mothers often pass that to their daughters. So if your mother's hypothyroid, you will likely become hypothyroid. As we talk about, breast cancers often pass through family history, coronary artery disease, osteoporosis. There's lots of different things that can pass through your history, and you need to talk to your mom in particular about what she's going through.
So often it's trying to find the right opportunity. I mean, it sort of seems grim at times to talk about things that could happen, but if you don't have these conversations, then how can you pass along the information to generations
It's
to come?
important. It's so important, and it's valuable information because whenever I'm assessing a patient's risk of looking at cardiovascular disease or if they're going to fracture, I want to know what happened to mom because that certainly gives me great information to know what's going to happen to you. And although those conversations can be somewhat uncomfortable, try to make it fun.
Yeah.
I mean, it can be get a glass of wine, sit down and talk with your mom, say, hey, when did you go through menopause? That is a really important question because our ovaries all have a limited lifespan, and what your mother's ovary lifespan is likely going to be yours, so the age of her menopause is likely to be similar to yours. So that's a really neat and important question to get answered.
Well, you have a client, or actually a couple of clients, who are a prime example
Yes.
of this. Let's listen.
My mother had thyroid issues. We weren't aware that she had thyroid issues, and that would have helped me determine what I had earlier, and I could have passed it along to my girls. And well, actually, my son has it too, and we could have all known what to do with it, and it would have been a lot easier.
And so knowing that really helps me to be aware and kind of pay attention to it and be my own advocate when I go to the doctor.
All right, so we talk about the timing on this, since a lot of us are going to be spending time with mom for Mother's Day, maybe
Makes you
at the
better.
spa, or maybe at brunch. Maybe you could do, you know, mimosas and menopause.
Oh, I love it. The M&M, I mean, to a whole new level. But yeah, Mother's Day is right around the corner. We want to be sitting down with mom to share those gifts, share that love, but also it's a great time to share information between you two.
And write it down.
Oh,
You
yes.
never know when it might come in handy.
Absolutely, and save it for your next generation because if you have children, they want to know that information as well.
All right, Dr. Angela DeRosa, thank you so much.
welcome.
Appreciate it. All right, and hopefully that is helpful. I know it might, again, seem awkward about having that conversation maybe over Mother's Day brunch, but it could be a lifesaver.